Today I have been discussing the role of clonal interference in AML. So clonal interference is a term that has been coined by people in the ecology field and people working on artificial evolution of bacteria. And it's just the presence of competing clones within a single population. So this is also called parallel evolution when you look at the clonal structure of leukemias or solid tumors. So what we've done is to reanalyze a large data set of patients with core binding factor acute myeloid leukemia for whom 8 to 10 cytokine signaling genes were sequenced. Obviously these are the most recurrent ones, FLT3, KIT, ROS genes, etc. And the striking feature of this study is that patients who have 2 or more signaling mutations, and we suppose this occurs in independent clones, are those who fare the worst in terms of event-free survival and cumulative incidence of relapse. It mostly affects patients with core binding factor AML because this is the subset of AML where these mutations are most recurrent, and also this is a subset of patients who are very sensitive to chemotherapy, so where it is easier to capture differences in chemosensitivity. It doesn't affect early response rates as we assess them, complete remission or MRD kinetics after 1 or 2 cycles, but it does affect long-term outcomes. So it's more a question of long-term relapse rather than short-term response. So we're doing a number of experiments. We're trying to understand the stability of this process at relapse by sequencing pairs of samples at diagnosis and relapse. We are also trying to recapitulate this phenomenon in murine models of leukemia, and finally we are collaborating with mathematicians to try to recapitulate this in silico. I think beyond my talk there have been exciting allusions to the same phenomenon, although it was not explicitly quoted in other talks. For example, a very nice presentation from Lars Bullinger showing that probably the clonal competition of FLT3 IgG clones impacts response to chemotherapy plus midostaurin, and there is also data showing that clonal competition of RAS clones is a phenomenon that is greatly enhanced by exposure to venetoclax. So I think as these agents gain momentum, I think in the AML treatment field, we are to hear more and more about these clonal interference processes.